Just make sure you can hear me.
I can hear you.
Okay, well, you're next to me.
I mean, no, I have the headphones on.
It's like you're sitting next to me.
Yeah, so our audio, I hear my items, like, I thought I know what's that.
Oh, we're recording it too, right?
Yeah.
So I did.
Hey, can you hear me?
I can hear you.
I can hear you.
Hi, Vita.
Hi.
Good evening, everybody. My name is Sue Fastenau. I'm the nurse educator, and welcome to our program on healthy tips for the school year post-COVID, support for students with sickle cell. I'd like to welcome our speakers tonight. Jen Boughton, she's our social worker. Liz Castro is our pediatric nurse practitioner. Dr. Archana Sharma is one of our attending physicians, and Dr. Karen Long Traynor is our psychologist. So we can get started. Liz, Archer, Liz, do you want to start first?
Sure. Can you hear me okay?
Yes, I can.
Okay. I don't know why my camera is not working, but thanks everybody for joining us. We're just want to talk a little bit about how to transition to this new normal school year, and also just talk a little bit about how you can approach your different healthcare providers and team members on questions that you may have on going back to school. And just want to stress this is a really informal conversation. So if you have questions as you go along, just shout them out, raise your hand on the app, or do whatever it takes to get our attention so we can answer your question as we proceed. Any questions so far? No? Okay. So the big thing I wanted to stress out is that if you have any questions, just call us, come see us during our visit, or just drop us an email like you do normally for questions related to your healthcare. But if you have questions related to transitioning back to school, those count too. Nothing is a dumb question, and always feel like you can ask us anything, whether it's about wearing a mask to school, when to stay home, when to participate in activities, etc. Everything is a legit question, so feel free to ask for anything. The other thing that's important is to make sure your shots are up to date. Always ask your doctors at your regular visits, and don't assume, because sometimes doctors forget to check as well. So it's important that you ask us and make sure that we also stay on top of it. And don't ever be shy. Oh, go ahead.
I think, I didn't mean to interrupt you, Arch. I thought there was a lull there. My camera's not working either, but I can see the slides.
Okay.
So we're here to empower you to have the best school experience, because we understand that sickle cell impacts the students. The host would like to promote you. Okay, I'd like to join as a
Okay, I'm not sure what happened to Liz, but I do just want to make a comment on reaching out. If you are not on my chart, there is a something on my chart that you can actually use to get in touch with your doctor. So what happens is you can type a question to your doctor, and they usually get back to you in a reasonable amount of time. It may not be immediately because the messages come through, but give them a little time. Like if you have a question, you're like, okay, I have to go to school next week and I need to know X, Y, and Z. Give either Liz or Dr. Drachman or Dr. Sharma a shout out and just ask them your question. And that way you can have your question answered, and you don't even have to make the phone call. You can do it right on email.
Yep. And I don't know if anybody heard what I was saying initially, but we just know that sickle cell impacts you as a student, the families, parents certainly have stresses when it comes to missed days, and especially if the school isn't prepared to answer, or to understand what's happening. So that's why we're here. So we want the parents to talk to their kids about any concerns, reach out to us, as Dr. Sharma and Sue said. Definitely make sure your vaccines are up to date. And if you need to, set up a meeting with your child's school, and we're happy to join that. And we can go to the next slide. Little further back. All right, so yeah, so that's where we're at. So we've said a bunch of times, because we're pretty passionate and adamant about staying up to date on your vaccines. There's nothing that's going to protect your kids more than being up to date on vaccines and the COVID vaccine. And stay home when you don't feel good. Teach your kids good hygiene. For the older kids, practice good hygiene. You know, if you have to sneeze, try to sneeze into your arm. And masks are usually optional. They're not mandatory, I don't think, in many schools. There may be a school out there that it still is, and that's fine. I mean, mask does prevent the spread of COVID, so, and other bugs. So a lot of us haven't had a common cold in a while because of masks. So we encourage you to use them if that makes you more comfortable. Next slide. So when your child gets sick, we encourage you to have them stay home. I've never really had issues with families not keeping their kids home. And, you know, any type of sickness can lead into a sickle cell crisis. So rest, lots of fluids, call us or your pediatrician. If it's just a basic issue, the pediatricians, not even basic, but a pediatric issue, they can definitely take care of that. Do your strep tests, do your COVID tests. But if you're having any issues with your sickle cell or you have a fever over 101, we definitely want to know about it. If there's any prolonged pain, any issues with splenic pain, or just anything you're not feeling comfortable with, we are definitely always here for you. And we'll help you with the schools and the school nurses to help them understand what's going on. So it'll be a better year for everybody.
I had learned to unmute quickly by now, but no. So this is me. So as Sue said before, I'm Karen Long-Traynor. I'm the psychologist on the hematology team. And generally I work with kids around disease-related anxiety and stress or sadness, that it's tough to cope with just a chronic disease, as well as I do a little bit of behavioral pain management also. But what I want to talk about today is really just adjusting and going back to school and dealing with the typical back to school anxieties as well as the COVID related ones. So next slide, please. So one of the things that I want to point out is that even pre-COVID, the rates of depression and anxiety and just general distress were increasing. I'm not quite sure if it actually was increasing or if it was just being noticed and recorded, but either way, there was more documentation of depression and anxieties. So even without the stress of being home for a long time and this crazy 3-year-long pandemic, there was distress. Transitioning back to school under normal circumstances can be pretty anxiety provoking. And so then you add on COVID and it just brings a whole other level. But there are just the general typical back to school stressors. So for example, if you've got a kid who is a little bit more socially anxious, then going back to school after being away from peers, a little out of practice of social situations can definitely tick up those worries and that nervousness. The little kids can have some separation anxiety if they're away from their parents for the first time, or even if they've been going to school for many years after being home for a summer with parents, going back to school in the fall, there's just some natural separation issues. There might be new teachers, there might be new friends. Last year may have not been the best with everything that was going on, and then just kind of some concerns about what's going to happen in this coming year. One of the things, though, to really keep in mind is that, first of all, it's not guaranteed that going into school is going to be stressful. So that's really important to point out. And also, the kinds of stresses that kids have and parents have may not necessarily be exactly the same. So it's important to check in and find out, as a parent, to honor what your own worries are, but then also to check in to see what your kid is truly worried about. So there can be, a parent might be worried about safety, and a kid might be worried about peer pressure. There might be one set might be worried about academic issues, and the other is worried about just social engagement and getting along with peers. There's new environments versus separation from family. So there's a whole bunch of different nuances that can be stressors. Next page, please. So in general, going back to school can be worrisome. And whether it's about COVID or whether it's just in general or whether it's dealing with sickle cell while being in school, It is really important for parents to check in with their kids and to really validate what their feelings are. As a parent, it is natural to want to go in there and give them that pet talk, tell them that everything is going to be okay, go straight into problem solving mode. But unfortunately, that can actually hinder conversation, and it can hinder the ability to use that problem solving and that potentially really great advice. So what has to happen first is just to validate and recognize that, yeah, I understand this is really hard what you're having to deal with. So for example, if a little kid says, I miss you too much at school, I don't want to go. And before saying it's going to be okay and you'll get through it, or instead of crying with your child, which you might want to do also, just saying, yeah, you know, I miss you too. And it's hard to be away from each other. And I'm really proud of you for going. So there can be that validation of the feeling, and also a little bit of a show of problem solving or how to move forward or framing it in a different sort of light. One of the tricks that I really like to use with kids is using that word "and," because it shows that I can be sad and I can be successful. It's not an either or. So setting the tone. What I mean by that is that if you lead with some anxiety, your kid is going to respond with some anxiety. So staying calm, putting on that really good parent poker face that you may be just in turmoil on the inside, but if you can stay calm on the outside, validate the concerns, and really start to address what the actual issues are, you're going to be so much more successful. Along with this is being careful not to ask leading questions. Are you worried about going to school? Are you stressed out about COVID? Are you scared? All of those things really prime a kid to really start to think in that direction, as opposed to saying, how are you feeling about going to school? How are you feeling about COVID? And it opens up for there to be positive, neutral, negative feelings, as opposed to really putting in the kid's mind how they should be feeling about something. Along with validation, some of those "and" statements, you can start to validate that, yes, it's really hard to go to school. Yes, it's kind of scary. And let's also talk about some of the things that you're looking forward to. What are some of the things that you liked last year? They're already in school. Tell me something good that happened yesterday. I know it was hard, and that was hard, and tell me something good. So that it's both of those things together. Transitional objects are really great for little kids, even sometimes older kids. That can be a transitional object, just something the kid takes from home to school to give a little bit of comfort. So it's the fancy psychological word for bringing a photograph into school, or bringing a teddy bear, or something of comfort. Sometimes a parent and a kid will have matching teddy bears, and the parent goes to work with one and the kid goes to school with one. Or it can be a little note, just something to help the kid feel connected to home while they're there. Keeping a routine is really important. So as much as it can be challenging to keep a routine in everyday life, we got to be realistic here. Being able to do it as much as possible truly does give a kid a sense of security. They may complain that things are boring and we have to eat dinner at the same time every night, but that structure does give that sense of security to a kid. It's been demonstrated over and over again. Giving a kid an idea of what to expect during the day. If there's some sort of changes, you're leaving early for a doctor appointment, or you're missing the first half of school for a doctor appointment, or mom's going to pick you up at a certain time, or dad's going to be home at a certain time. Just giving a kid a heads up about what to expect during the day. And as much as you strive for that routine, also encouraging that flexibility. So routine, yes, and sometimes things happen and sometimes things change. So, and that's part of having that conversation of, okay, today is going to be a little bit different than typical because X, Y, Z. For kids, it's somewhat similar to the things that parents focus on in order to transition. But for teenagers, this is more for teenagers, but getting them to focus on that positive. That doesn't mean denying the negative stuff, but really, okay, what are the things that are actually okay about school? Even if it's just friends and lunch, fine. Those things are really important. And to really, and as a teenager, to talk about what your concerns are to whoever that might be, whether it's one of us on the team, a parent, a friend, a school counselor, anybody. Just talking about it and getting some of those feelings out is just really helpful. Next slide. So one of the big questions nowadays is whether or not to put on that mask. And it is not a simple question. I'm not here to tell you whether or not you should or shouldn't. That's for your family to decide based on circumstances and conversations with your medical providers. But either way, whether you decide to wear a mask, whether you decide to go to big social gatherings, there is going to be peer pressure on both sides, or there's going to be social ramifications on both sides. But before we talk about that, I want to just highlight that research to date, and I say to date because COVID is still really new. We don't know about long-term ramifications and long-term effects. But research to date really shows that there is not significant social harm to masking, that there has been concerns about language development. And yes, a mask can muffle language, but in the young kids that have been studied so far, there aren't any significant delays in language, that there aren't any delays in or change in the level of interaction when kids actually have the opportunity to interact. As far as understanding emotion, when shown a picture where half the face is gone, yeah, kids have a harder time of recognizing emotion. It's about the same when they're shown a picture with somebody with sunglasses and they miss the top half. But we are not static pictures. We compensate. That when we can't see our entire face, we display emotion through tone of voice, through the volume of our voice, through gestures like I'm making a ton of now. Just body language. There is so much that goes into communication besides the lower half of our face, and kids are learning to read that, and we adapt. That's what we do. So with that being said, it's not to suggest that you need to wear them or not to wear them, but what do you do with all of that peer pressure that potentially can come, leaning a little bit more towards the side if you're masking? Because right now it seems that, at least in New Jersey, there's a heavier population on the free face side. So first of all, sitting down and clearly explaining the family decision, giving truly honest answers in an age-appropriate way to your kid about why your family has chosen this. For a young one, it may be something like, we want to keep other people safe, we want to keep grandma safe, because we want to keep ourselves safe. And older kids talking about the nuances of things, that our family has decided that we want to wear a mask or not wear a mask because of health issues, because of there's still a lot of COVID around, or maybe on the other side because there's more vaccines out there. The intensity of sickness seems to be a little bit lower. Whatever it is, being honest about why you made those choices, and even some of the nuances about why you made those choices. Once you talk about what your family is going to do, make sure to model that behavior. And what I mean by that is that if you want your kid to wear a mask in school, you have to wear a mask in the grocery store, or you have to wear a mask whenever you're inside around crowds. Just so that it's consistent. That whole thing about do as I say and not as I do, that just doesn't work. That's not how kids learn. It can be really helpful to identify other people in the community or other people that are important that are doing something similar. So while a lot of peers may not be wearing a mask, you might point to a celebrity that likes to wear them. There are several that fall on both sides. Or teachers that are demonstrating similar behavior to your family values, or a principal that is doing something. And whenever you talk to your kids about, or your family about what your decision is, portray confidence and comfort with this decision. Whether or not you actually feel it, again, this is some of the parent poker face and the teenage poker face, is that what you exude to the way that you talk about your decision is going to influence how other people react to you. It's not 100%, but if you are a little bit more confident and casual in your decision to mask or unmask, you are less likely to get more of that severe peer pressure. Again, not guaranteed, but just a little bit less likely. Whereas if you are kind of nervous about it and hemming and hawing and trying kind of like being derogatory about it, or making, saying, yeah, I wish I didn't have to, but mom's making me, that is probably going to increase the pressure. So as a parent, modeling confidence, and as a parent and a kid, demonstrating confidence when you talk about it to other people. Along this it's a really good opportunity to teach acceptance for other viewpoints. That while you're talking about what your family decisions are, it's a really good opportunity to talk about how different families have different values. And some may be focused on increased vaccinations. Others may be focused on, well, there's still a lot of spread and there's still a lot of people at risk. And as teaching your kid that as you want others to respect your opinion and your family decision, you need to respect other people's decision and opinion about stuff. Focusing on what you can control. Another good lesson, that we can't control other people. And this is kind of obvious, but the only thing that we can do is control what we do. We can give an explanation for our choices, and the other person can take it or leave it, and we have no control over that ultimately. They may still be pretty obnoxious about it. They may be really accepting about it. On the chance that you run into somebody that is kind of obnoxious about your decisions, it is really helpful to have conversations ahead of time about how you're going to react to that. Modeling or role-playing or thinking about or talking about how you're going to respond when somebody teases you for wearing a mask or not wanting to go to a big gathering, or vice versa. Think about how you want to explain your decision, how much you want to say. If they press you, deciding how you want to react to that. Do you want to walk away? Do you want to tell a teacher? Do you want to continue to argue? And again, there's no hard and fast rules here, but it's deciding ahead of time what you're comfortable with and what is in line with your family values is going to give kids and yourself some of that ammo you need to be able to respond to just respond to people who are just trying to peer pressure you. Next slide. So even with these just regular tips, you might still be distressed. As a parent, you might be distressed about sending your kid to school. As a kid, you might be distressed about going. And we are here to support you. So reach out to anybody on your sickle cell team. That's any of the nurses and the physicians and APNs, Jen, myself. We are all here to help. There are supports in schools. The guidance counselors in schools are particularly trained for helping, not necessarily with sickle cell in particular, but just helping with adjusting to school and dealing with peers and dealing with school-related distress. And there's always, if it feels like that is just that those conversations aren't helping, you can seek out some professional support. So as I said, I'm available to all of the kids in this program for psychotherapy and mental health support, whether it's a one-time check-in or something a little bit more extensive. So wait, before we go on, I didn't write this down, but I kind of wanted it just as an add-on, a little thing. So one of the things to help reduce stress has, Liz was talking about taking care of yourself and having a good night's sleep. And sleep is one of those things. It's that you hear a whole lot about how to have really good sleep hygiene. So you hear about the no screen time before bed and going to bed at a reasonable time. And one of the things that is neglected or brushed over, or I don't know, what is one of the most important things for adjusting your sleep schedule and getting a good night's sleep doesn't have to do anything with what time you go to bed, is what time you get up. That if you want to get yourself into a good cycle where you're getting enough sleep, you can't just, okay, decide to go to bed at 10 o'clock one night. You got to start with the morning, because you can force a body to stay awake when you're tired, but you can't force a body to go to sleep when you're not. So if you're a teenager and you're staying up, you sleep in until 1 o'clock on a Sunday before school, there is no way your body is going to be ready to go to bed at 10 p.m. unless you're like out running a marathon or something like that. Your body is going to be awake for 12 to 16 hours, depending on how active you are, and there's not a whole lot you're going to be able to do about it. So if you torture yourself and try to fall asleep when you haven't been awake long enough, you are going to perpetuate all those bad habits of laying in bed and trying to bore yourself with screen time and all of that stuff. So if you have bad sleep habits, focus on your awake time. Okay, my little side rant. Thank you.
Hi, everyone. I'm Jen. I'm the social worker on the hematology team, and I'm going to talk about school accommodations. Next slide. So most of you probably know this already, but there is something called a 504 plan that is meant to provide medical accommodations for kids in school. And so a 504 plan is a legal document. And what it really does is it protects kids who have medical needs to make sure that all of their medical needs are met, also while all their academic needs are met. And so any kid with a chronic medical condition is eligible to get a 504 plan, and that includes our kiddos who have sickle cell. A really important note is that some private schools don't actually follow the 504 guidelines, but instead they call it ISP, which is Individualized Student Plan. And 504 plans follow kids for life, but they get renewed every year. Next slide. So lots of you guys have probably seen this list already. I see some familiar faces on here. I know we've started this process for you guys. And so these are some of the accommodations that we request for our patients with sickle cell. And so the really important accommodations are excused absences for doctor's appointments, hospital stays, even if you're not in the hospital and you're just having flare-up or crisis or need to be home because you're feeling unwell, those absences should also be excused. Really having unlimited access to water, the bathroom, extra layers, air conditioning, heat, all those really good things during the school day, and then also getting breaks during physical activity, and just extended time, if you guys are not feeling well. The other really important thing to know for parents is that there is something called homebound instruction. And so if your child is in the hospital or out due to sickle cell crisis for more than 5 days, and they have a 504 plan, then they are legally required, the school is legally required to offer you homebound education, which is a really fancy phrase for a teacher or somebody needs to get online and make sure that your kid has not fallen too far behind. And so all of these accommodations work for kids of all ages. So kindergarten is typically when the 504 plan gets started, and that can follow you through your whole life. And some of the accommodations look different in college, and I know I see a college kid on here, so it's fairly similar, but a little bit different, where some accommodations include you can have access to other students' notes. So if you need accommodations at school, you would see the Office of Disability on your college campus. They can arrange for you to have, for other students to take notes, and then you can get photocopies of those notes if you were out of class. And then we also provide accommodations for housing. So making sure that you guys have air conditioning that you can control in your dorm room, access to a mini fridge so you guys can have water, and any other access that you guys need so that you can comfortably live on campus. So there's two sets of accommodations. One is for making sure that your medical needs are met so that you can succeed in school. And the other is to make sure that your housing accommodations are met so that you can also succeed in school. So those are two separate plans. Next slide. Okay, so how do you request a 504 plan? So most importantly, contact us, your sickle cell team. So any of us can help you get that process started. If what we'll do is we'll give you a letter that is requesting a 504 plan or requesting those college housing accommodations. You can reach out to the school nurse or the school guidance counselor. The school counselor is typically the person who will help get that 504 plan started. And so they will arrange a meeting with your child, your parents, all the teachers, and get everyone together to make sure that all accommodations are written down and signed off on so that you guys can be successful at school. If you are having trouble reaching your school team, we're happy to reach out as well. So we can always send the request letters to the nurse or the counselor, and we can also talk to anyone at the school to help you get that process started. Especially now, I know a lot of school districts are changing all their schools and kids are getting redistricted into new schools. And so every time you change a new school, you need to restart that 504 process. So you have to make sure that, the guidance counselor, the principal, all those folks know that you need a 504 plan. So if you have changed schools this year, please let us know so we can get you those letters ahead of time. I guess school's starting next week. So just let us know as soon as you can. The most important thing is that you guys as the family should be involved in 504 planning. And so the school, must include you so that you have a say in your child's medical needs at school. And also, as I said before, we can do this for college as well. The process to request a 504 plan is a little bit different for colleges. You would go onto your school's website, check out the Office of Disabilities, give them a call, and they will let you know whether you need to request the plan or if the medical team needs to request the plan first. So either way, there is a medical portion of it. So we will help you guys do that, but just make sure that you're calling them and just letting us know what needs to get done. Next slide. Key takeaways or 504 plans are so important. It's so important that kids get accommodations that they need and deserve at school so that they can be successful in school and also have fun in school. So it's so important that all kids have these plans in place. It's, some of the little kids teachers are more accommodating, and so parents aren't always as concerned about getting the plans done quite so early, but the benefit of getting it done early is it stays with you, every single year. For our older kids, it's really important because this 504 plan impacts when you're taking state testing. If you're taking the SAT, those accommodations count for those really big, long, strenuous tests. And so it's really important when you're trying to plan for college or next steps that you have accommodations during those times too. And then second most important thing is just always reach out to us. So we're all here and available. Any questions about school concerns, you need us to call the school, you need help with school, we are here for that. And you can reach out to anyone on your sickle cell team. And then this is my contact info to my email, my phone number. So if you realize just now that you need a 504 plan, take down my email or my phone number and call me tomorrow.
Okay, we have one question. If you have any other questions, you can type it in the chat box. So one question that we have is for Jen the question is, can you discuss if your medical condition changes, can you change your plan mid-year?
You definitely can, yes. So you can update your plan at any point in time. So, if you are healthy and then all of a sudden you get diagnosed with something, you can change your plan the very next day. So the schools are always willing to accommodate. You would need an updated letter from us. So if your child's medical condition has changed, just let us know and we'll get you guys the updated paperwork.
Does anyone have any questions from the audience or anything else that they want to know? I appreciate everybody coming tonight.
Another question, what is the difference between an ISP plan and the 504 plan? Is one more beneficial than the other?
Good question. Do you mean IEP and 504 or ISP?
Either or.
Okay, so an IEP is an individualized education plan, and that plan is really geared towards academic support. So if your child has a learning disability and they need more support to succeed academically, most kids would get the IEP. If your child has a medical condition or needs help with behavior, they would typically get a 504 plan. There's a little bit of a difference. The IEP doesn't follow you for life. And so when you graduate high school, those accommodations end. The 504 plan, that can get transitioned over into college. But in terms of support at school, they are fairly similar. It's just typically kids with medical needs get the 504 plan, and then kids who need more learning support get the IEP. And sorry, just to add, some kids, if they already have the IEP at school and they need sickle cell accommodations, the school might just lump those accommodations into the IEP. And it's not wrong to do it. It's just they're already making those plans and they just stick it in there. And so either one is absolutely fine.
Okay, and how long is the process to get approved for the 504 plan? Like, let's say they were supposed to start it like this week. How long would you say they will be approved for it?
Sure. So by law, the schools have 30 days to answer your written request, and then they have 30 additional days to make the plan with you. And so it can take up to about 60 days to get the 504 plan. However, most schools are really accommodating, and so they move much quicker than that. And once we send over the paperwork requesting the 504, most of the schools will follow those recommendations until the 504 plan is officially in place.
Okay, another question. What are things that you suggest I can bring to school to keep in my book bag to help with my symptoms if I have them during class and it's open to everyone?
So I think the first thing is check with your school nurse, just talk with your school nurse. Even this week, you can email them or call the school, because there's medication order sheets that I can fill out and fax to them right back, or scan to them right back with pain medicine. So if you need to have pain medicine, this is for the younger kids. For the college kids, it's a little different, but if your younger kids need Motrin, or some of them have asthma in addition to their sickle cell or their albuterol, we can fill out that paperwork so that the school nurse has it available to give to your child. And it's always better to have it there, even if they've never needed it, because the one time you really need it, and the kids are in pain, it's just never a good thing. And sometimes the school nurses panic a little bit because they don't understand sickle cell and they're calling an ambulance, or they're stalking you at home. So anything we can do to prepare for a crisis or a fever. So when it comes to a fever over 101, the school nurses really just need to call the parent or whoever can pick up the child, the emergency contact, because that is a emergency room visit. So they need to go to the ER. If the only way to get there is ambulance, that's okay too. For pain crises, we try to deal with that as we would at home. You start with ibuprofen or Tylenol. And if we need to move on to bigger things, normally we don't give the school nurses morphine unless it's something that it's very regular for the kids to need. And then always have good hydration on them. So extra water in their backpack, sweatshirt in case the temperature changes. And again, we have, Jen has written up a beautiful letter that I happily sign all the time, that says, what they need in a schoolroom or in a dorm room to be comfortable. And we give you guys a good accommodation so that the teachers can't really, because believe it or not, there's some teachers that do not let kids wear hoodies. And it's been an issue where we've actually had to write a note, or during the really cold winter months or the really hot spring, summer months, or early fall months, the kids are able to stay inside if it's just too hot, or if they can't go to gym, we can accommodate all of that so that it's not embarrassing the day of. So, when in doubt, just call us. But I would say for any of you, for the kids under, their senior year, have ibuprofen standing. But I do have to send an order for that, because the school nurses can't just give it out, even though it's over the counter. And if it's for the college kiddo that's on here, always have ibuprofen in your bag, so that you can start with that, have it in your dorm room or, at home. And then a lot of times, if you escalate to where you do need morphine and you should have a prescription, we'll usually give you about 10 to 15 just to have as a safety net. And then this way we can usually keep you out of the hospital if possible.
The other thing I just want to add there is if parents find that your school nurses need more information about sickle cell, to reach out to the team. I think that a lot of people just really don't know about it, and knowledge is powerful, and as long as we can let the nurses know what the needs are of a sickle cell patient, I think that you're going to be in a better place as well.
And we do come to the schools. I mean, we weren't doing it with COVID, but we can do a Zoom with the school counselor, nurse, principal, teacher, whatever you need. It's sometimes tricky, especially when a teacher decides to create a situation, and it's not all the time, but we've all had the teacher that doesn't want to be helpful with certain situations. It's just better to have it documented. And like Sue said, we're happy to speak with the staff. We actually have booklets for the school, so we can always give you one to take with you, or we can give it, we can come in and chat with them.
Great. Okay, another question. I have trouble making friends at school, especially during COVID. So what can I do to help?
So it's not easy to make friends, first of all.
You're
and
muted,
that
Karen.
It's easier for some than others, but some of the nice ways to do it is to find a club that you can join. That any sort of structured activity that you can participate in, it's a little bit easier. So instead of having to just strike up a blind conversation and feel really awkward, you're around other people and you slowly through the activity get to know each other. If there aren't clubs or activities that you're comfortable joining or you're interested in, there's always, believe it or not, people like talking about the weather. If you want to make some comment about how hot it is, that it might seem kind of silly, but it is a very common conversation starter and one that people are okay with. Or you can, if you're in college and you're going there for the first time, you can talk about getting lost, some sort of common silly experience, shared experience to start a conversation. And not everybody is going to bite, but some people will. And also having just being patient with yourself, that making friends is not as easy as everybody says. And our minds can tell us that there is something like, don't talk to that person. We're really trained to be hyper aware of social situations. So our minds can kind of be really annoying sometimes. And learning to differentiate when your mind is being helpful and when it's being that friend that's giving you some bad advice, which mine does all the time. I think everybody's does all the time.
Well, that's what I was going to add. I think most people think that when they see a group of friends that everybody just had that happen magically. It's normally everybody's panicking a little bit as to, are they going to talk to me, especially when it's a new school, or, a lot of these schools, like Jen was saying, they're redistricting, and you have to be without your, one bestie or even one comfort that, you giggle with in the middle of class, which I don't encourage, of course. But yeah, it's not that easy for anybody. And you kind of have to fake it till you make it, and don't be so hard on yourself. And you can always call us.
Yeah.
We're always willing to talk.
Are there any more questions? I just want everyone to know that this presentation is going to be recorded and will be on the patient education website on the CINJ site. And I did have several nurses reach out to me that were unable to attend tonight that I will be sending that to. Thank you very much for attending, and thank you all for speaking, and everyone have a wonderful night.
Bye, everybody.
Hi, everybody.